Hello everyone, Dr. Pease here. Now I've just finished about 30 minutes of massage on Annabelle. Thank you, Annabelle, for having me today.
Thank you, Mr. Pease. Thank you for being here in my house. I'm so happy with my massage. So relaxing, helped me a lot to be more healthy. So I'm appreciating you here to do my adjustment. So thank you.
Well, thank you very much. Okay, we're going to do the adjustments now.
Okay.
I'm going to have you lie on down. I want you to make, face down. And I want you to make room to breathe.
Okay.
Now, what we've done, everybody, go ahead and lie on your stomach with your face here. You can make room to breathe. Got room there?
Yeah.
What we've done, everybody, in the last 2 years is we've added a sheet so that from home to home, nobody touches each other. Just a little prevention. So we followed about 30 minutes of massage on Annabelle, relaxing her muscles in preparation for the adjustments. Now, I've already checked Annabelle and her back. She's a healthy person getting a preventive tune-up. But she does have a little tension in the neck, and she does have a little tension in the low back. Following motion palpation, which is a technique we use to feel, palpate, if the bones are tighter than the one above and below, that would give us indication, even without x-ray, where to adjust. So lie your head face down there and relax your arms and shoulders. So bring your chin in and relax your body. So I'm going to come into her thoracic bones, these 12 bones right here, and I'm going to gently come forward. And not all bones are out of place. More often, it's tension of muscles, and that's why I like to use the massage machine to relax muscles in preparation for the adjustments. So I'm coming on up the thoracic spine. There's 12 vertebrae in the mid-back, T12 to T1. And as I gently come forward, again, not all bones are out of place. There's an opportunity for a movement right there, and she got a wonderful release. I like to think that if we go gentle enough, we let the person's body decide to adjust, not the person trying to force to prove how good they are, because not all bones need to be adjusted every visit, every level, every time. So continuing up the spine, take a deep breath in, Annabelle, and as you let the air out, fully relax your shoulders. Now we're getting closer to her neck involvement. She has, again, just some tension. Again, breathe in. And as she exhales, fully relax, I come in for these gentle adjustments. And then now, I'd like you to turn towards me on your side.
Okay.
Turn on your side. We're going to go on into the lower back now. Either way, but you want to face this way first? Okay. I'm going to, hold on. Slide down about a whole foot. I'm going to put the pillow under here for your head.
Okay.
There we go. So as she lies on her side, I want you to scoot a little bit towards the edge of the table. Perfect. I have several opportunities for movement here to reduce tension and pain, increase range of motion, increase mobility. Youth is mobility, age is stiffness, and we want to maintain mobility. So I'm going to have her bottom leg a little straighter. A key part of an adjustment for the lower back is to pull this arm forward. And then as you lie your head again on the table, there we go. Are you relaxed?
Yes.
And you stay where you are now. I'm going to fine tune the adjustment. I'm going to pull that shoulder in so that we have all the tissue slack taken out of the lower back in preparation for the adjustment. Are you relaxed there on the pillow? Yeah. Now, the doctor's leg is just for balance. The adjustment comes from the hand, the doctor's hand. So the reason for the leg, if a doctor uses their leg, they're being sloppy. We want just to come on over so we can do a clean adjustment for the opportunity of lumbars, lumbosacral, and sacroiliac joints. I'm going to actually cock my hand, like cocking a rifle, into a counterclockwise position so that when I adjust, I'm going to be adjusting downward for the weight of the body, compression, gravitational forces. We're going to be going the opposite direction to give the vertebrae and the disc an opportunity to have mobility. As the bones move apart, it creates a sound. So gases and fluids, where any two bones meet, which is a joint, chiropractors treat fixations, which we call subluxations. Subluxations are bones within their normal range of motion that are fixated or caught. And as we adjust the bones apart, it creates the audible release. So rather than thinking, as it would look on a YouTube video, that we're adjusting through here. Now, we can do that if we want a rotation adjustment, but in general, for a healthy person, I want to do an adjustment in traction to allow mobility from the weight-bearing joints. So the adjustment, again, counterclockwise contact, downward adjustment. We're going to adjust you now, Annabelle.
Ow!
And there we go. Now, it would sound like it would hurt, but Annabelle's a little bit dramatic. Did that hurt?
No!
No, it was more of a surprise, right? But let me tell you, she got about 5 levels.
It doesn't hurt.
She got lumbar adjustments, lumbosacral, and sacroiliac adjustments. Now, I'd like to think if the bones move that easily, it surprised me a little that you got that much movement.
Yeah.
That the body needed it. If the body didn't need, I go gentle enough that we're just going to move on from not getting an adjustment. But boy, did it want it, huh? Go on over to your other side. We're going to adjust the other side. Now, again, she's a healthy lady, so we're doing a general adjustment. If somebody had a particular problem that we saw viewed on x-ray, we would adjust accordingly. We could go in rotation, we could have the vertebrae adjust backwards, we could go forward, up, down. Okay, scoot towards me now. We're coming to the other side. Saying there's only one bone at each level in the lumbars. So this is an opportunity for right rotation. If a bone had subluxated to the left, we now can adjust right. Also, we're coming over to the right sacroiliac joint, which is the bottom of the pelvis. Things like vacuuming, walking. We're pivoting. These are gliding joints back here, the sacroiliac joints. We want to maintain the freedom of those joints. Take a deep breath in. As you let the air out, now this time I'm going to clockwise my hand when I contact to adjust downward in traction. We get pressure off the disc. Relax your body over. Now watch how gentle I'll be. We're not trying to get bones to move. With the opportunity, I like the keyword opportunity for movement. Relax your body. I'm going to adjust you now. Okay? Did not need one. So all of her adjustments were needed at the same bones that we were adjusting, but in left rotation, not right rotation. Now straighten your legs. Cross your fingers, your stomach. Now, remember when I first started the adjustments, I had Annabelle lying on her stomach and I adjusted forward in the mid-back? Well, now we're going to go to those same bones and adjust the opposite direction. We're going to have the opportunity for these upper bones to move back rather than forward. And that's why we adjusted gently in the beginning, because what if we adjusted the wrong way when the bones wanted to go back rather than forward? So on this one, we're going to take the pillow out so she can rest back on the table. We're going to have my hand act as a fulcrum. A fulcrum is like the center of a teeter-totter. And what that does is allow a gap above my hand for the bones to move back towards the table. Thank you. So here we go. Very gently again, we're going to take the bones above my hand, and we're going to have Annabelle rest back over my hand, back to the table, and there it is. Several adjustments in the direction, especially those seated jobs, where the shoulders are forward or heads down, and kids today, they're texting like this. We used to type like this. Kids are even further down. So this adjustment in prevention allows for good posture. Lastly, we're finishing up. We're going to go to Annabelle's cervicals where she had moderate tension palpated prior to the massage that I did on Annabelle. We're going to take those 7 cervical bones and we're going to very gently. Now on this, I just want to say a safety thing. How easy it would be for somebody to watch a YouTube video and think that, oh, I can do that. Like a massage therapist or a trainer, a bodybuilder, weight training. They're around people that might show them what to do. But there's more than meets the eye of safety. It's not only what to do, but what not to do in the interest of the patient. That's why we do a full consultation, full exam, and we're also given 4 years of professional school following college. So just like a dentist or a medical doctor, our profession, specialty chiropractic, is 4 years of professional school beyond college. And what that does is give us the time for the teachers, the instructors, the doctors to train us in the safety of the adjustment also, not just how to do it. So let me show you a few things. I'm going to come in to prepare, and one of the things I like about being mobile, I have the time. I worked 20 years in an office setting, had my own office in Indio, California for 14 years. 6 years prior to that, in 1984, I would work at other people's offices for 6 years. So after 20 years of going room to room like every other doctor, I went mobile 19 years ago. I'm in my 39th year of practice, 68 years old. I just love to work. I don't want to retire, and God willing, I can keep working. Well, in the safety of the adjustment, it would look like on a YouTube video, and this is why we do not recommend anybody doing what I'm showing you what we do here. There's more than meets the eye. For instance, what if somebody had had a stroke in the past? We wouldn't adjust the neck. There's certain rules of when not to adjust somebody, just as importantly as when to adjust somebody, or when to refer out in the interest of the patient, the teamwork of second opinions and referrals. Okay. So as I come into her neck, I can already begin to feel the tension of her neck. Thank you. So I want goals in her case for a healthy lady is to relax the muscles, allow for the mobility. So we have this machine to relax muscles, which is more often the case, the G5 massage machine. And then we have sometimes the bones needing to be freed up. There's 7 neck bones, 7 cervicals. So before, and this is where I was getting to explaining why I left the office to go mobile. One of the advantages was now I have the time, not going room to room like I used to, that I can prepare the person for the adjustment, and in her case, tension. I'm going to take about 30 seconds. I won't do all 30 seconds on the video, but I like to do on my patients about 30 seconds of hand massage to begin to relax the person. I purposely have the pillow out so she can rest back. And then the second of 3 techniques I use in preparation is I traction the person and I hold, and I have you breathe in and out. And as I traction, I tell the patient, I'll tell you when I'm going to do the adjustment so there's no surprises. In my practice, like the teamwork of the patient and the doctor, that I can tell them when I'm going to adjust them, so in teamwork they can relax and I can adjust gently. So I'm tractioning and holding. Now, in about 1 out of 10 people, now I could go a lot stronger, you've seen it on YouTube videos, but if I just traction lightly, I'm going to adjust upward now. About 1 out of 10 people will get an audible release in traction. I like to do it on everybody because 9 out of 10, they're quiet. And the third technique in preparation for the adjustments is the stretch. The trapezius muscle goes from the shoulders on over to all the neck bones and beyond. But I want to take the head and the shoulder and stretch and hold. Stretches are held. And you'll notice I'm going to come at different angles to incorporate different portions of the trapezius muscle that fans out from the shoulder to all the neck bones and upper mid-back bones. So I'm going to be stretching now. Again, techniques that I have the advantage of not needing to go room to room throughout the day because I don't have the overhead. Now notice I'm not looking at her, I'm looking away. That's another part of this 2 years ago, not breathing on the patient, not having them breathe on me. So now I've just stretched the right trapezius. I'm going to go to the left side now and equally stretch. We're preparing her for her neck adjustments. Again, 3 techniques I use that I have the time to do being mobile. And then when we have the person much more relaxed, because who doesn't get tension in the upper back, neck, and shoulders from just stress, physical or mental, or combinations of it. And then following the stretch, I bring back the pillow. Again, another safety measure. If you have the head slightly forward, it's just a little technique that we know to allow for safe adjustment. 39 years, never had a problem with the patient. So now we have the patient slightly flexed. And then I want to tell you something about the adjustment. There are many techniques. You can go from office to office. Wonderful doctors out there, they have different techniques they'll use. I prefer the open-handed adjustment. It makes for a gentle adjustment. But this is something you wouldn't know watching a YouTube video. People think, well, I saw the chiropractor or whoever was on video turn the person's head, and then when they get to end of range of motion, they would just go a little further. That's way too far. That's not safe. We have arteries, nerves, muscles, tendons, ligaments. We want to just go gently. So what we do is, rather than rotation, which would put us from the midline on over about 60, 65 degrees in her case, okay, and about 70. 90 would be parallel with the floor, and then a young person, they can go 90 degrees at 15, 20 years old. We could turn their head parallel to the floor. But that's not what we want to do. The safety of the adjustment, I come in and don't just use rotation, because that would put us way too far. I extend, she's going to relax and let me do the extension. I'm going to extend her head, laterally flex, and rotate. Now I have her at 30, 35 degrees to do the adjustment safely. We didn't get near the end of range of motion. Now remember, don't do this at home. Don't do this on your loved one. It takes 4 years of chiropractic school following college to learn the proper techniques of adjustments. So I'm going to adjust you now. Relax your head on the pillow with the 3 combination. There's the 30 degrees. Okay. And very gently on my part, again, it's the opportunity for movement, not trying to get the movement. In her case, if you were to follow me from person to person, some people don't get any movement. Some people get 1 or 2. Some people get all 7 cervicals. We're going to finish up with the other side. Your part of this is to take a breath in, Annabelle. And as you, let the air out. I'm going to come in for the other side now. Rest your head on the pillow. I'm going to adjust you now. And there it is. You can come on up, and you did wonderful, Annabelle. Come on up. Come on up. And you can have a seat towards the light again. James, her husband, has been wonderfully doing the photography for us. Thank you, James.
You're welcome.
Annabelle to say the last few words.
Thank you, husband, to the video for us, making the video for us. Thank you, Mr. Pease, for doing my therapy adjustment. I appreciate you here. Thank you so much. You helped me a lot with my health, so I really need it. So, thank you.
Bye. Thank you so much. Bye-bye.